disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Listen up. Today we're unpacking the powerful science behind the 1 hour glucose test and why it may be the missing piece in diabetes care.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jedha.
Hello, wonderful people. Thanks for joining me for episode 115. I've been getting so many messages lately from people saying things like, my fasting glucose looks fine, my A1C looks fine, but something still feels off. Or, I checked my blood sugar 1 hour after eating and it was way higher than I expected. Is that normal? Honestly, these are great questions. And today we're exploring what I think is one of the most fascinating and important emerging areas in diabetes research and care, the 1 hour glucose test. In research, you'll hear it called 1 hour post-load glucose, but for you and me, it's simply your blood sugar reading that's taken 1 hour after a meal, or during a 75-gram oral glucose tolerance test taken 1 hour after instead of the traditional 2 hours. So this is important because in clinical practice, we focus on the 2 hour post-meal levels, and it's the 2 hour levels that get tested in an oral glucose tolerance test to diagnose prediabetes or type 2 diabetes. But there is a growing body of research that's shown the 1 hour reading can reveal early metabolic changes years before traditional tests shift. We're talking earlier detection, clearer prediction, and a much more accurate picture of what's happening with your insulin response and your metabolism. In fact, many research now suggests that the 1 hour value may be one of the most useful tools for identifying high-risk individuals, even when fasting glucose, A1C, and 2 hour oral glucose tolerance test results look completely normal. And for prediabetes and type 2 diabetes, it may also offer valuable insights to help guide you in a better direction. So today we're going to break down what the science says and how you can monitor this at home to make more informed decisions about your own treatment plan and daily routines. So let's start by looking at what's supposed to happen after you eat. Whatever you eat, whether it's oats, a vegetable stir fry, or a sandwich, your blood sugar rises and your pancreas releases insulin. And here's the important part. Your peak blood sugar typically happens close to that 1 hour mark. Not fasting, not 2 hours, right around 60 minutes. And that means the 1 hour reading shows the moment when your metabolism is working the hardest, the point where insulin is being pushed to handle that rise in glucose. It's essentially the metabolic stress test. So if that 1 hour number is higher than expected, it can signal that insulin isn't working efficiently or that your pancreas is having to work harder than it should. And that can be happening in people without prediabetes or type 2 diabetes, or even when fasting glucose and A1C look perfectly normal. Traditionally, doctors and clinical tests focus on testing that fasting glucose, the A1C, and the 2 hour oral glucose tolerance test. These are helpful tests, and certainly for diagnostic purposes and monitoring, A1C remains stable. But according to this surmounting research, fasting glucose, A1C, and that 2 hour OGTT test can miss the earliest stage where problems begin. Fasting glucose is more commonly tested than an OGTT, that's the oral glucose tolerance test, because an OGTT is time-consuming and it's more of a hassle, whereas fasting glucose and A1C can be taken from a fasted blood sample and they're pretty easy tests to do. But fasting glucose can stay normal for years while the body struggles after meals. In many people, A1C only changes after months of chronic elevation, and the 2-hour test only shows whether glucose has come back down, not how high it spiked. The 1-hour reading, on the other hand, captures that peak glucose response, and that's where early metabolic dysfunction shows up. After digging deep through the science, it's apparent that across multiple studies, researchers have noticed the same thing. People who looked completely normal on fasting, A1C, and 2-hour OGTT still had significantly elevated 1-hour glucose levels. And those people were the most likely to progress to prediabetes or type 2 diabetes later on. But this test isn't just relevant to people without diabetes. It's also a predictor for progressing from prediabetes to type 2 diabetes, according to research. And in type 2 diabetes, it can indicate higher risk of complications and heart disease. So there are multiple factors why this 1-hour test is strongly emerging as a potential new clinical guideline. So let's talk about the threshold that shows up again and again in the research. It's 155 milligrams per deciliter or 8.6 millimoles per litre. This isn't a random number. It's been identified in multiple independent studies. Here's what researchers have found over the years. People with 1-hour glucose above 155 or 8.6 were significantly more likely to develop diabetes over time. Even when fasting, A1C, and 2-hour results were normal, the 1-hour value was the strongest predictor of future diabetes, and the critical threshold was 155 or 8.6, above, equal to or above. So those above 155 or 8.6 consistently had higher blood pressure, higher triglycerides, more abdominal fat, higher body mass index, lower insulin sensitivity, worse beta cell function in the pancreas, and a poorer cardiovascular risk profile. This was even true even when all traditional tests looked normal, and that's why researchers describe these individuals as the high-risk normal group. They wouldn't receive a prediabetes diagnosis, yet their metabolic health is clearly changing beneath the surface. Published recently in January 2026, another major study brought all of this research together and introduced a really helpful concept, calling this an intermediate metabolic state. In people with normal glucose, the early changes were already happening, and the 1-hour reading was the marker that revealed it. Even more interesting, the 1-hour test outperformed all other measures for identifying early blood sugar dysregulation. It was the strongest predictor by far. I find this all very interesting, as I often speak about pre- and T2 diabetes being an altered metabolism and the connectedness of things like high blood pressure and high cholesterol. So now researchers are seeing this test can identify and connect all of these metabolic alterations because they are all part of the same puzzle after all. In terms of prediabetes and diagnosis of prediabetes, another major study suggested that the 1-hour value may actually detect early prediabetes better than the standard criteria, again using 155 or 8.6 as the cutoff on that 1-hour glucose test. In people with type 2 diabetes, the higher the 1-hour glucose was above 155 or 8.6, the higher the incidence rate for chronic complications. All very interesting. Now, what happens when the 1-hour value goes well above 155 or 8.6? This is where the research gets even more interesting. A Japanese study looked at a marker of early atherosclerosis and found that when the 1-hour value approaches 190 milligrams per deciliter or 10.6 millimoles per litre, we're not just talking about glucose metabolism anymore. We're seeing the earliest signs of vascular stress. To be clear, that doesn't mean someone is destined for cardiovascular disease. It simply shows that glucose is spiking high enough to place additional stress on the blood vessel lining. something that over time could contribute to inflammation and oxidative changes in the vessels and potentially greater risk of heart disease. And there has been other studies showing that in terms of cardiovascular risk and cardiovascular studies, even with normal 2-hour oral glucose tolerance test readings, people with a 1-hour value above 155 or 8.6 had higher stiffness in the arteries, worse endothelial function, that's the lining of the blood vessel wall, and higher long-term cardiovascular risk. Another pattern repeatedly found across studies is that when people hit 200 milligrams per deciliter, that's 11.1 or higher at that 1-hour mark, often have normal fasting and normal 2-hour values. So that's really strange and you wouldn't expect it, but the spike, that 1-hour spike, is the only sign that something is happening in some people, and it was peaking really high. In fact, several studies show that the 1-hour value may detect type 2 diabetes earlier than the 2-hour value. A 1-hour OGTT reading above around 209 milligrams per deciliter or 11.6 millimoles per litre has excellent sensitivity and specificity for identifying diabetes, even when fasting glucose and A1C remained unchanged. So when you look across all of these studies, the message is unmistakable. For the 1-hour post-meal glucose, 155 or 8.6 is the point where the body begins sending clear signals that glucose handling is becoming impaired. It may increase risk of diabetes in those with normal glucose and in those with prediabetes, and may increase risk of complications and cardiovascular issues no matter what stage you're at. So all of these are really important and interesting facts.
With Dr. Jedha's VIP online membership, you'll have proven, practical support to lower blood sugar, weight, and medication. Receive delicious weekly meal plans that keep you inspired each week, or browse thousands of easy, diabetes-friendly recipes and cooking classes. Explore the huge members library with hundreds of foods, supplements, blood sugar, and nutrition resources that answer your questions. All this and more. Join as a VIP member today. Visit type2diabetestalk.com/programs.
So what does all this mean for you? Well, clearly, if you don't have a diagnosis of pre or T2 diabetes, the 1-hour glucose test can be an early indicator of metabolic stress, that intermediate metabolic state where things might look normal, but beneath the surface there could be lower insulin sensitivity occurring, the potential of impaired beta cell function, higher liver and visceral belly fat developing, and a worse cardiometabolic profile overall. It might also show up as weight gain, high blood pressure or high cholesterol. So a 1-hour test can be a very useful signpost, and if it's equal to or above 155 or 8.6, it's an alarm that you need to get proactive with nutrition and lifestyle. For those living with prediabetes, it's also a highly relevant signpost for you. If your 1-hour post-meal test is above 155 or 8.6, it indicates higher risk of progressing to type 2 diabetes, even where your fasting glucose and A1C is normal, which we do see in many cases. Testing 1-hour glucose could provide further insights into what's happening at your glucose peak. And if it is going above that 155 or 8.6, you can focus on getting more proactive with nutrition and lifestyle. Because what the research also shows is that when someone who is in this intermediate state or already has prediabetes, those with elevated 1-hour readings were also the people who showed the greatest improvements once they did things like lowered carbohydrate intake, reduced liver fat, increased their activity levels, and made structured nutrition changes. They all had significant improvements in insulin sensitivity, beta cell function, and that long-term risk of progressing to type 2 diabetes dropped by a huge amount, around 80%, which is really encouraging data. For those living with type 2 diabetes, the 1-hour glucose test still matters in a slightly different but very important way. Because once type 2 diabetes is diagnosed, most people are told to monitor fasting glucose before meal readings or 2-hour post-meal readings. These are all important tests without a doubt, but what we now know from the research is that an elevated 1-hour post-meal glucose may be an independent risk factor for developing chronic diabetes complications. That means even if your A1C is improving, even if fasting glucose looks stable, a high 1-hour spike can still place extra stress on the blood vessels, the kidneys and the cardiovascular system, so it's not a number to ignore. For people with type 2 diabetes, that 1-hour reading becomes a powerful feedback tool. It shows you how much pressure your meals are potentially putting on your pancreas, your insulin response, and your blood vessels in real time. And just like in pre-diabetes, a high 1-hour number doesn't necessarily mean things are getting worse. It simply tells you there could be room for improvement, for further adjustment. Reducing the carbohydrate load of the meal, adding more protein or healthy fats to ensure your meals are balanced, taking a short walk after eating to aid with that muscle glucose absorption. And by taking simple steps, that 1-hour reading can drop dramatically, sometimes within days. And these improvements translate into real-world outcomes. Better daily glucose control, smoother glucose curves, fewer post-meal symptoms, and lower long-term risk of complications. And the earlier you can catch these spikes, whether it's 155, 180 or higher, the more responsive the body tends to be. So no matter where you sit on the spectrum, normal glucose, prediabetes or type 2 diabetes, research tells us the 1-hour glucose test offers incredibly valuable insight. It helps you understand what's happening at your glucose peak and gives you a clear, practical point of action to move your health in a better direction.
Kimberly said, "Thank you to Dr. Jedha for your guidance and for all the wealth of knowledge and recipes you offer here at DMP. This has been a positive change for me. I've lost weight and exercise more. I'm so thankful that I found this site."
Now, you might be wondering, well, if this 1-hour test is so enlightening, why don't most doctors use it or even know about it at all? There are a few reasons. Firstly, guidelines move slowly, very slowly. Professional bodies wait for long-term outcome trials and guidelines, they can take years to be updated. Fasting glucose and A1C tests are cheap and easy, and these are the defaults, even though they're potentially late indicators. The oral glucose tolerance test is considered inconvenient, and most labs only draw fasting and 2-hour values. The 1-hour measurement simply isn't standard at this point. Doctors are also not currently trained to interpret it because it's not in the guidelines, it's not routinely taught, and the healthcare system is built around diagnosing disease, not detecting early risk. But even though it's not widely used in clinics, it doesn't matter. You can capture this information yourself. To use the 1-hour test at home, you don't need a lab, you don't need a glucose drink, you just need your usual glucose meter. Pick a regular meal and check 1 hour from your first bite of food. And you look at the 1-hour peak. If it's under 140 or 7.8, that's a good, strong, healthy response. At 140 to 155 or 7.8 to 8.6, that's fine too, but could indicate early signs to watch and whether it's staying below that 155 and 8.6 or it's creeping higher. Because if it starts going to that 155 or 8.6, this could be an early sign of metabolic stress or additional stress that you can focus on to improve results. If it's higher, up at the 180s to 200s or 10s to 11.1s, this indicates stronger stress on your body, on your pancreas and blood vessels. And it's not a reason to panic, but certainly an opportunity to be proactive. You don't have to test every meal. Just gather information and start noticing any trends. So as you can see, the 1-hour glucose test isn't about adding more complexity or more stress around numbers. It's about gaining clarity. It gives you a window into how your body is actually handling food in real time at the moment when glucose and insulin and your body is under the most pressure. For some people, it's the early warning sign that something is starting to shift beneath the surface. For others with prediabetes, it helps identify risk and shows where focused nutrition and lifestyle changes can potentially make a significant difference. And for those living with type 2 diabetes, it becomes a powerful feedback tool to help reduce glucose spikes, improve glucose control, lower A1C, and lower long-term complication risk. This research gives us further insights into understanding the body better, spotting patterns earlier, and using that information to make smarter, more effective choices to improve our health. If you're one of our members, head to the Members Library to find a new detailed guide that walks you step by step on testing and assessing your 1-hour post-meal levels and exactly what to do if you find they're a bit higher than the normal levels. Thanks so much for listening today, and I'll see you in the next episode. Dr. Jedha, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.